A hernia might sound rare, but it's more common than you think. It affects people from all walks of life, often silently. Imagine a strong wall developing a weak point, a small bulge. That's similar to what happens in our bodies with a hernia. An internal part pushes through a weakness in the muscle or tissue wall. Understanding hernias is crucial as they can cause discomfort and complications. With proper medical attention, hernias can be treated effectively. Let's delve deeper into hernias and learn how to address them confidently. Our bodies are incredibly resilient, often giving us subtle signs when something isn't quite right. A hernia often starts as a small, painless bulge, easily dismissed as insignificant. Ignoring these signs can lead to significant problems. Understanding hernias and seeking timely medical advice is crucial. Take charge of your health and address concerns early. Notice any unusual bulges or pain, reach out to your doctor. Early detection ensures a smooth recovery. Your health is your priority. Seeking help is strength. Hernias, though sharing a common mechanism, are not a one-size-fits-all condition. They can occur in various parts of the body, each with its own characteristics and implications. Think of it like this. Just as a house can have weak points in different areas, the roof, the walls, the foundation, our bodies can develop hernias in specific locations. Understanding the different types of hernias is crucial for both patients and medical professionals. It allows for accurate diagnosis, tailored treatment plans, and effective management of the condition. In this section, we will embark on a journey through the human anatomy, exploring the various types of hernias and shedding light on their unique features. Let's start with the most common type of hernia, the inguinal hernia. This hernia occurs where the abdomen meets the thigh. Imagine a weakness in the abdominal wall. The intestine or fatty tissue pushes through, creating a bulge. This bulge is a sign of an inguinal hernia. It may swell when standing, coughing, or straining. Inguinal hernias can cause discomfort or pain. Moving beyond the groin, we encounter other types of hernias that deserve our attention. One such type is the umbilical hernia, which, as the name suggests, occurs around the belly button. Picture the navel as a small window in the abdominal wall. An umbilical hernia happens when part of the intestine pushes through this window, creating a bulge around the belly button. These hernias are more common in infants, often resolving on their own as the abdominal muscles strengthen. However, umbilical hernias can also affect adults, particularly those who are overweight, pregnant, or have a history of abdominal surgery. Our bodies have a remarkable way of communicating with us, often through subtle cues and sensations. Hernias, while potentially serious, often begin with whispers rather than shouts. Learning to recognize these early signs is crucial for prompting timely medical attention. One of the most common signs of a hernia is a visible bulge or swelling beneath the skin. Imagine a small, soft lump appearing in the groin area, near the belly button, or at the site of a previous surgical scar. This bulge might be more noticeable when standing upright or coughing, and it might disappear when lying down or applying gentle pressure. While some hernias are painless, others can cause a range of discomforts. You might experience a dull ache, a pulling sensation, or a burning feeling near the bulge. It's important to remember that not all bulges indicate a hernia. Sometimes, what might appear to be a hernia could be a harmless fatty deposit or a swollen lymph node. However, it's always best to err on the side of caution and consult a healthcare professional for an accurate diagnosis. If you notice a persistent bulge, especially one accompanied by pain, discomfort, or changes in bowel habits, it's essential to seek medical advice. Don't ignore these signs or try to self-diagnose. Early detection and treatment are key to preventing potential complications. Remember, your health is your priority. Seeking medical attention for a suspected hernia is not a sign of weakness, but a proactive step towards safeguarding your well-being. When you visit your doctor with concerns about a potential hernia, they will conduct a thorough examination to determine the cause of your symptoms. The diagnostic process often begins with a detailed medical history review. Your doctor will ask about your symptoms, their duration, any previous surgeries, and your family history of hernias. Next, they will perform a physical examination. This will involve visually inspecting the area where you're experiencing symptoms and gently feeling for any bulges or protrusions. The doctor may ask you to stand, cough, or strain, as these actions can make a hernia more prominent. In some cases, a physical examination alone is sufficient to diagnose a hernia. However, your doctor might recommend additional tests to confirm the diagnosis or rule out other conditions. Undergoing a hernia operation is a significant step towards reclaiming your health and well-being. Like any journey, preparation is key to ensuring a smooth and successful experience. Think of it as packing your bags with all the essentials: knowledge, support, and a positive mindset. Your medical team will provide you with specific instructions tailored to your individual needs and the type of hernia you have. These instructions may include dietary restrictions, such as fasting for a certain period before the surgery. This is important to prevent complications during anesthesia. Additionally, you might be advised to temporarily stop taking certain medications, especially blood thinners, which can increase the risk of bleeding. Anesthesia plays a crucial role in ensuring your comfort and safety throughout the hernia operation. It's like a temporary pause button for pain and awareness, allowing the surgical team to work their magic without causing you any discomfort. The type of anesthesia used will depend on various factors, including the type of hernia you have, your overall health, and the surgeon's preference. For most hernia operations, general anesthesia is the preferred choice. This means you'll be completely asleep during the procedure, unaware of any sensations or activity. General anesthesia is administered through an intravenous IV line, allowing for precise control over the dosage and timing. Section 3. Open surgery, a step-by-step guide to repair. Open surgery is a traditional approach to hernia repair that has stood the test of time. It involves making a single incision near the hernia site, providing the surgeon with a clear view of the affected area. Imagine a skilled craftsperson meticulously repairing a tear in a piece of fabric. That's the essence of open hernia surgery. The surgeon begins by making an incision in the skin and gently separating the underlying tissues to expose the hernia. Once the hernia is identified, the surgeon carefully pushes the protruding tissue back into its proper position within the abdomen. Section 4. Laparoscopic surgery, embracing minimally invasive techniques. Laparoscopic surgery, often referred to as minimally invasive surgery, has revolutionized the field of hernia repair. Instead of making a large incision, laparoscopic surgery utilizes small, keyhole-sized incisions to access the hernia. These incisions act as portals through which the surgeon inserts specialized instruments and a tiny camera called a laparoscope. The laparoscope transmits real-time images of the surgical field to a high-definition monitor, guiding the surgeon's every move. With enhanced precision and control, the surgeon repairs the hernia using miniature instruments, often reinforcing the weakened area with a surgical mesh. Section 1. Navigating the road to recovery. Your post-operative journey. Congratulations on successfully completing your hernia operation. As you begin your recovery journey, it's natural to have questions and perhaps feel a mix of emotions. Rest assured, this is a normal part of the process. Think of the post-operative period as a gradual transition back to your routine, with each day marking a step closer to feeling like yourself again. Immediately after the surgery, you'll spend a short time in a recovery area where our medical team will closely monitor your vital signs and ensure you're comfortable. We'll keep a close eye on your blood pressure, heart rate, and pain levels to ensure a smooth recovery. During this time, you might feel a bit drowsy or disoriented from the anesthesia. That's perfectly normal. Listen to your body, managing pain and discomfort. As the anesthesia wears off, you might experience some pain and discomfort around the incision site. This is a natural part of the healing process, and we will provide you with appropriate pain relief medication to manage it effectively. Remember, pain management is essential for a smooth recovery. Don't hesitate to communicate your pain levels to our nurses or doctors. We're here to help you feel as comfortable as possible. We'll work with you to adjust the dosage or type of pain relief as needed. In addition to medication, gentle pain management techniques like applying ice packs to the affected area can help reduce swelling and discomfort. back on your feet, gradually resuming activities with care. While it's important to rest and allow your body to heal, gentle movement is encouraged soon after surgery. This might involve short walks around your hospital room or home, gradually increasing the distance and intensity as you feel stronger. Think of it as finding the sweet spot between rest and activity, allowing your body to recover without becoming stiff or losing muscle mass. We'll provide you with specific guidelines on when you can safely resume more strenuous activities like lifting heavy objects, exercising, or returning to work. It's crucial to follow these guidelines closely to avoid putting undue strain on your healing incision and muscles. Nourishing your recovery. Dietary tips to support healing. What you eat plays a vital role in your recovery. In the initial days following surgery, your body needs extra nutrients to repair tissues and fight off infection. We recommend a balanced diet rich in fruits, vegetables, and lean protein to support healing. Think of your meals as fuel for your recovery, providing the building blocks your body needs to repair and rebuild. Hydration is equally important. Aim to drink plenty of water throughout the day to stay hydrated and support your body's natural healing processes. Water helps flush out toxins, transports nutrients to cells, and keeps your body functioning optimally. Every surgical procedure, no matter how routine or straightforward, carries inherent risks and potential complications. Hernia operations are no exception. However, it's important to remember that these risks are generally low, and most patients sail through their surgery and recovery with minimal issues. Think of it like this. Even a short car journey has a slight element of risk, but we still take the journey because the benefits outweigh the potential downsides. Our commitment to you is to provide clear, honest, and transparent information about the potential risks associated with hernia operations. We believe that informed patients are empowered patients, better equipped to make decisions about their health and well-being. During your consultations, we'll discuss these risks in detail, addressing any concerns you might have. Section 2, Rare but Real Recognizing Serious Complications. While serious complications are uncommon after hernia surgery, it's essential to be aware of them. Just as a seasoned sailor keeps a watchful eye on the horizon for potential storms, we want to equip you with the knowledge to recognize and address any unusual symptoms promptly. One potential complication is infection, which can occur at the incision site or, in rare cases, within the abdomen. Signs of infection include increasing pain, redness, swelling, warmth around the incision, or discharge from the wound. If you notice any of these symptoms, it's crucial to contact your medical team immediately. Another rare but serious complication is bleeding. While some bleeding is normal during and after surgery, excessive bleeding can be a cause for concern. Section 3. Your safety net. Prompt action for a smooth recovery. Remember, knowledge is power, and understanding the potential risks empowers you to be proactive about your health. By following our post-operative instructions carefully, attending follow-up appointments, and promptly reporting any unusual symptoms, you play a crucial role in ensuring a smooth and successful recovery. Think of us as your dedicated support team, always available to answer your questions, address your concerns, and guide you through every step of the way. Our goal is to provide you with the highest standard of care, not just during the operation itself, but throughout your entire hernia journey. We're committed to your well-being, and we're here to support you every step of the way. Section 1. Your hernia journey. Taking control, seeking support. Navigating the world of hernias might initially seem daunting, but remember, knowledge is power. Armed with the information in this guide, you're better equipped to understand these common conditions and make informed decisions about your health. Remember the analogy of the whisper that grows louder. Addressing a hernia early is crucial to prevent potential complications and return to a life free from discomfort. Don't let fear or uncertainty hold you back from seeking help. Our team of dedicated healthcare professionals is here to guide you through every step of the way, from diagnosis to treatment and recovery. We understand that each patient's journey is unique, and we're committed to providing personalized care tailored to your individual needs.